Good afternoon, and thank you so much for joining us today for our webinar offering a market outlook for the medical equipment market in Latin America. My name is Abel Delgado. I am the Digital Marketing Director for Global Health Intelligence, and I'm going to be serving as the moderator for today's webinar. So before we get started, we just want to give you a quick overview of what to expect. We're going to have about 20 minutes or so of presentation, and then we'll answer your questions. So the way you can ask a question is by looking at your user panel, and you should be able to see an icon there that says Q&A. You click on that particular icon, it'll bring up a window. You write in your question, hit enter, and we'll receive it. So feel free to ask questions at any point in time in the webinar, and we'll address as many as we can. Now, one question that we always get is if the materials are going to be available after the webinar, and the answer to that question is yes, absolutely. So what we do is within about 24 to 72 hours, we'll send out the video and the webinar presentation you're going to be seeing here today, and you'll receive that. So we send that to everyone who registers for the webinar, so you will get that. So let's move on here and to talk a little bit about GHI itself. We started in 2014. Our focus is providing strategic data about medical equipment and devices in Latin America. We also provide strategic data about surgical procedures in hospitals in Latin America as well. And this helps companies that are in these industries to make decisions about sales and marketing. As part of that, we also share some of our data that comes from our exclusive databases. And that's in the form of free reports and also paid reports. So the covers you're seeing up there are from some of the free reports we've had over the years, and also a couple of our paid reports. The most recent one is for 2021, which just is about to come out. And a lot of the data you're going to see here today comes from that particular report. So that's basically our focus and what we do. And that's how we came about this data in the first place. Let's look at our speakers now. We're going to have Guillaume Copart lead us off. He is the CEO and founder of Global Health Intelligence, and he's going to be talking to us about the overview for Latin America. And he's going to be followed by Christophe Leroy, who is the co-author of this particular report and worked on a lot of the data. And he's going to be talking a little bit about the outlook for 2022 and what to expect. And both, of course, are going to be available for questions. Now, this is our agenda for today. Basically, we're going to be covering the technology adoption in Latin America among the hospitals. Then we're going to get into a bit of an outlook for 2022 and the market and what to expect, and then we'll handle our Q&A. In terms of our legal notice, I encourage you to read that at your leisure, but basically focuses on liability and the information that we're presenting here today. We encourage you to not make any sort of business decision based just on the data that you're going to see here today, and in fact, reach out and consult us just to be sure about this sort of thing, and also to use your own due diligence, because these are obviously weighty decisions, and so that has to all be considered. So please take a look at that legal disclaimer when you have a moment, because it's important information. I don't want to read it word for word, so we can actually get to what we want to share today. So let's move on to the next step, which is going to be starting off the presentation, and I'm going to turn the floor over to Guillaume so that he can start us off. Guillaume.
Thank you, Bill. Hello, everyone, and welcome to our webinar. It's always a pleasure to see so many attendants today. Now, as a lot of you know, we put a lot of work into the reports that we publish, in the webinars that we present, and all the material that we produce. And so it's very rewarding for us to see so many attendants as we have here today to discuss the ideas and the topics that we're evoking, especially as it pertains to hospitals in Latin America and technology penetration. As some of you know, and as Abel mentioned, we like to keep our webinars very lively and very dynamic, so please feel free to use the Q&A button that's at the bottom of your screen to share with us any thoughts, any comments that you have as we go through this presentation. And we're going to try to do our best to answer your questions throughout the whole of the presentation, but also during the Q&A session at the end. Very good. Thank you, Abel. Now, to set the stage, there are approximately 100,000 hospitals worldwide. 1/4 of these hospitals are found in China. 1/4 of the world's hospitals, or just about, are found in developed economies, namely the United States, Europe, Canada, Japan, Australia, and others. And 1/4 of the world's hospitals are found in Latin America. Now, this is why Latin America is such an important region. And it's also the reason why we are here today. If we make a list of the top 10 emerging markets by number of hospitals, we see that 4 of them are found in Latin America. So understanding the hospital dynamics in the region, particularly in times of high disruption, as the one that we've seen, or experienced for the past 16 to 18 months, is critical and key. And here with us today is my esteemed colleague and good friend, Christophe Leroy, who's going to be delving into some of the impacts of the COVID pandemic, the crisis, and the variants that we're seeing and the impact on Latin America. Next slide, please. So Latin America as a whole has a vast installed base. We're talking about over 20,000 institutions. We're talking about 50,000 operating rooms, over 1 million beds installed across the region. But we see that on a hospital and on a per capita basis, the picture is actually quite different. The average Latin American hospital is nearly 3 times smaller than its counterpart in the United States or in Europe. And the size of the hospital plays a huge role at the time of conducting investments or leveraging capabilities or infrastructure. Right? So this is a key determinant to technology adoption and also to the ability to invest in capital equipment, in technology, and progressing of science and healthcare at large. Now, Chile is the exception in the region. We're talking about a country that on average has approximately 134 beds per institution. Now, it just so happens that Chile also stands out for having the highest proportion of tech adoption across all the region, as well as the highest proportion of specialized hospitals. Next slide, please. There are 3 key factors at play when we assess the performance of healthcare systems in any country across the world. The first of which is the quantity of institutions. And by institutions here, we're referring to hospitals, clinics, laboratories, diagnostic centers, etc. Essentially, all the types of institutions that embody healthcare and in which patients can go and get care. The second key determinant and factor is the number and the type of equipment that is found within these institutions. And here we're using the term equipment very largely. So for instance, it could be capital equipment, but also devices, technologies, pharmaceuticals, and products that are found within the institution that enable giving care. And the third pillar and key strategic element in order to deliver care is the ability to have staff and staffing needs within the institutions that help promote care to patients. And here we're talking about nurses, physicians, surgeons, obviously, but also all of the admin personnel that enables care to be optimal within a certain context. And when we compare Latin America to the OECD average, we see that as a region, we are high performing in terms of the number of institutions, yet we have a lot of room for opportunities and growth, both on the equipment side as well as on the staffing side. So here at GHI, we've been mapping and conducting an analysis of hospitals and healthcare systems across the region since 2014. And this has helped us gain an understanding of how hospitals adopt and integrate technology and technological equipment into their infrastructure and into their institutions. This essentially has led us to the existence of an adoption roadmap, a technology adoption roadmap, which can be used both by institutions and hospitals to see what they should be integrating next or where they should be striving to grow, but also it can be used by medical equipment and medical device manufacturers who seek to better understand the landscape and identify which institutions and which hospitals are the best fit for their products, their solutions, and their technologies in the market. Now, this is a very interesting a concept that can be applied very broadly. So on that note, it's challenging to present all of this for every case scenario that can be used in a 30-minute webinar. So we offer you the possibility to maybe explore this in greater detail in a one-on-one conversation. So with that, I'm just going to open it up for a brief poll question. If you guys would be interested in entertaining a 30-minute conversation with some of our leadership team, either myself, Christoph Leroy, Mariana Romero, or other project managers. We're going to keep these responses confidential, but please do let us know. That way we can reach out if you are interested. So the 3 options are yes, you are interested. 2 is possibly, but not for the time being. Can contact me within the next 3 months, or 3, you're not interested. Okay, so I'm going to leave just a few moments here for you to capture those responses. For those of you that have already captured a response, please remember that you have the Q&A button at the bottom of your screen to share with us any comments, questions, or thoughts that you have for the webinar. Terrific. Well, thank you for your time and your opinion. I'm now going to hand the baton over to my esteemed colleague, Christophe Leroy.
Thanks a lot, Guillaume. It's a pleasure to be here. I'd like to set the stage for some of the data that we feature in the 2021 medical equipment report. First, by setting the stage for what is happening in the region at a macroeconomic level. So there is a recovery going on, but it is more tentative and the region is lagging behind other markets such as North America. So we do expect in the 2022 recovery, it just may take a little bit longer than in other regions of the world. Now, this has a number of impacts when it comes to healthcare investments. Governments and government budgets are still under pressure, so that will have an impact on public expenditures for healthcare. And on the private side, a lot of the countries throughout the region have experienced layoffs in the formal economy, and that has had an impact on the number of people who have private healthcare insurance. This translates directly into whether or not patients may seek out procedures and different types of surgeries or medical healthcare. So I just wanted to couch what we're going to see in the next few slides in those overall opening remarks. And then I'd like to take a deeper dive, if we can move into the section, to some of the findings we'd like to share with you. The key message is that the vaccination drive across the different countries of the region will be a determining factor for how quickly some of the healthcare investments return, and also will have a determining impact on sales of medical equipment, medical devices, and other healthcare items. There are differences across countries. Some countries like Chile and Uruguay are much further ahead in administering vaccines to their adult populations. Others are lagging behind and won't reach herd immunity until 2022, among them Colombia, though it's by no means the only country in that situation. What impact does that have in terms of actual purchases of medical equipment and other factors that have a bearing on the market? Well, on the one hand, as we all know, there have been certain types of equipment that have seen a surge in demand as a result of the pandemic and the treatment of COVID patients, whether it's personal protective equipment, ventilators, patient monitoring systems. That high demand we expect will continue in the next few months, and then will begin to taper off as vaccination drives continue to expand. Supply chains had been disrupted throughout the pandemic for a number of reasons, and we expect that as lockdowns lift, those challenges will be mitigated. And this is an important point because in many Latin American countries, including Chile and Argentina, the lockdowns have been a lot stricter than they have been in other regions of the world and indeed in other countries in Latin America. We do expect private hospitals to be driving the return, the purchases of medical equipment and devices as they prepare for the return of procedures, which we'll talk a little bit more about in just a minute. And the other trend we expect to see continue is that as a result of budget constraints and having to reprioritize purchases and expenditures, value-based equipment and economical products have made significant inroads in a variety of categories, and we expect that trend to continue. So that's not to say that premium goods don't have a place in the market. They do. It's just that we believe that space will be a lot more fought over than it was before the pandemic.
Christophe, thank you for these high-level insights on a regional basis. We actually have a question that just came in directed for you. What kind of supply chain disruptions occurred in Latin America in 2021 or 2020 through 2021, and what could affect the resumption of supply chain logistics moving forward?
Okay, well, let me take the first part of the question. What we started seeing, we saw the tip of the iceberg first, which were a number of disruptions in logistics within countries. Some of the most affected hospitals and institutions were smaller clinics, as well as regional hospitals outside of major urban centers were having a much harder time obtaining stocks and deliveries of critical ingredients and products. And then working our way back, what we realized is the port infrastructures and the transport routes to get imported products into the countries also suffered directly from the lockdowns. So what we expect moving forward is that as lockdowns ease and as they are lifted, we expect some of the bottlenecks at ports of entries to be alleviated, though there's still some probability that the prices will stay high. And what could affect some of these logistics challenges and how fast they're solved could actually have to do with factors that are political in nature. So, for instance, Colombia's had a very intense past few weeks with demonstrations for political reasons, and that has had an effect on supply chain, just to give one example.
Terrific. Thank you, Chris.
So as I was mentioning earlier, if we can go to the next slide, part of what we expect to see is a return to pre-pandemic levels of surgeries and procedures, including elective surgeries. And in fact, in a number of markets, we expect this to return to pre-pandemic levels as early as the end of 2021. In other markets, it will likely happen at the beginning of 2022. And a number of hospitals are already reporting that they expect to exceed the level of procedures that they had been registering before the pandemic. And this may seem somewhat surprising, but in fact, this increase masks some differences. So actually, I wanted to ask you, Guillaume, in some of your recent conversations with clients, what have you noted in this regard?
Yeah, thank you, Chris. And in fact, very on point slide, because we just got a comment from Carlos Medina, who's inquiring about the estimated time of recovery and what we expect to see in the coming months. So thank you, Carlos, for sharing that question with us. What we see is that countries are moving at different speeds across Latin America in terms of the recovery. On one hand, we're seeing Mexico, for instance, really being ahead of the curve, and particularly as it pertains to the private sector. Private hospitals in Mexico are cycling through their procedures at a faster rate. They're being more responsive than the public sector, definitely in the same country, but also they're ahead of the pack as it pertains to the other countries in the region. And what we see simultaneously in parallel to all that is Brazil, who's really been hit very hard by the COVID pandemic and has had a lot of cases and recently is just exiting the end of a very large second wave of COVID cases, is a little bit farther behind. So we expect recovery to take place at different speeds based on the different countries that we're looking at, but also on the different institution types. And we see private institutions simply just reacting a little faster than their public counterparts.
Thank you. So what I'd like to do is also share some of our findings in the reports, more specifically about different device categories. So on the next slide, we just feature some of the highlights that you will find in our 2021 report. We systematically compile the totals of different equipment categories by country, by hospital type, and then aggregate them at the regional level. Some of what you'll see here may not be that surprising. I mean, there's been growth in certain types of equipment. Needless to say, hospitals have realized that they need to be well-resourced in certain equipment types. COVID has driven demand for items such as ventilator and patient monitoring systems. And just so you know that we expect some of this to continue throughout 2021, and we'll be reporting on that in the coming months. But we also track systematically specialized equipment, which is on the next slide. And what I'd like to point out here is that we do see significant growth in certain categories, but this may be paradoxical because we also know that throughout these last few months of the pandemic, a lot of hospitals have paused their capital equipment investments. Now, part of the growth we're seeing here has to do with the life cycle and the planning cycle for some of these capital investments. Some of the decisions were made before the pandemic and were executed throughout 2020, irrespective of what was happening in the ICU wards. Now, what we do expect is next year in 2022, when we look back on the data that we're tracking this year and will complete in December, we do expect a number of these categories to stay flat. And in others, you'll see slight decreases, which has to do with some aspects of capital equipment in the installed base simply not being replaced because budgets were directed and prioritized elsewhere, among others for the treatment of COVID patients. Now, what we've also done in the report, moving to the next slide, is we have also zeroed in onto the main markets within the region. So you'll see them listed here. We have taken a closer look at Brazil, Argentina, and in Central America as a region. And what we've done is we've highlighted all the different, the year-on-year growth for the different equipment categories. Here on this slide, we just feature the equipment category that saw the highest growth. Some of this can be explained by what I was just mentioning a few moments ago from a low absolute number in terms of installed base. Some select investment has showed up as a big percentual increase. I was wondering, Guillaume, if you wanted to shed a little bit more light on this. I know we were talking about this earlier in the month.
Yes, absolutely. Thank you, Chris. So what's interesting is we see robotic surgery systems appearing in multiple areas here. And as you mentioned, robotic surgery systems are very uncommon across Latin America. We're talking about less than 200 across the entire region. So when you have, a sub-region like Central America going from 2 devices or 2 equipment types to 4, we're seeing, a boast of 100% growth. And that's, again, as you mentioned, a result of the very low initial absolute number. But what's really interesting to note is that in the full report that's going to be available in the next couple of days, we delve into these categories on a much broader level, and you can go into the geographies and the countries and see exactly what equipment categories are growing the fastest and in what rates. So Francisco, I see you asked a question about what new or innovative equipment is estimated for hospitals to incorporate, or will they continue to focus on a much more traditional line? To answer that question, I would say that it really depends on the institution itself and the type of institution it is. So for instance, the leading hospitals across the region, here we can talk about the Albert Einstein, Sírio-Libanês, Grupo Ángeles, Medicasur. Those type of institutions will always be at the forefront of technology adoption and of equipment adoption. That's their raison d'être. That's the reason why they're operating, and that's the market that they're catering to. On the flip side, the majority and the bulk of hospitals will probably tend to remain in the traditional type of equipment that they're at. In fact, as a result of the pandemic and as a result of the budget crunch that both private and public hospitals are experiencing, we expect that initial traditional base or more traditional model of hospitals to grow in terms of absolute numbers. So Francisco, thank you for your question. And essentially, the short answer would be that that top of the pyramid will continue to contract a little bit, at least for the next year or two, until budgets get back online and hospitals can recover their investment levels. Christoph, back to you.
Thank you. To complement what you're saying, what we've also done in the report, and which we're showing just a snapshot of on the next slide, is for each of these main markets in the region, we have compiled a list of the top 10 institutions that we believe are the technology leaders within their respective markets. We do this by through a detailed count of some specific equipment, which goes back to the technology tier adoption model that you spoke about earlier, Guillaume. And so we've developed criteria to single out some of the leading hospitals in each market. Here's just a snapshot. Now this list is being continually updated. So when the report comes out, you'll see that some of these totals may shift slightly, as well as the ranking of certain hospitals. But we just wanted to show you what this entails. And it's one of the, by featuring these hospitals, it also enables some equipment manufacturers to zero in on what are the top tier institutions that they should be focusing on for certain types of equipment categories.
So Chris, a great question here. If we can just go back to that previous slide, do you see any changes amongst the technology leaders from last year?
There have been a number of changes. There are two types of changes. Some hospitals that we had already identified as technology leaders have, what I would say, consolidated their lead by investing in additional units of these specialized equipment types. So to put it more colloquially, they're even more leaders than they were last year. And some of these updated counts will be featured in the report. And on the other hand, some of the rankings have changed. So some hospitals have are featured higher up because of the investments they've made. So this is a result. Some of these types of equipment are on long planning cycles. So they had made these investments prior to the pandemic and implemented them throughout 2020. And some will still continue implementing some of their investments this year. So my feeling is that among the top hospitals, they're going to continue to consolidate their position, and then some of them are standing out. Specifically, we saw changes in rankings in Brazil and Argentina. So we look forward to being able to publish those changes in those two markets. And that brings me to one of the questions that we received in the chat about which are the countries that are standing out. On the one hand, we've seen the greatest changes in markets such as Brazil and Argentina. Brazil obviously being the biggest market by number of institutions, by number of beds. And Argentina, though it may have other issues on the macroeconomic front, in terms of healthcare, we have seen some significant progress by the leading institutions. Another market that we pay close attention to for the reasons that you mentioned earlier, Guillaume, is also Chile. So we believe that will continue to be the case there.
Yeah, absolutely. Great point, Chris. And I think that goes to Federico Telmo's comment, which countries really stand out. You nailed it. Brazil, simply because it's the largest market in the region. We're talking about over 6,600 hospitals. Chile, because the average hospital in Chile is much larger than the regional counterparts, nearly twice the size. And that enables the institutions to really leverage their capital infrastructure at a much greater level than other countries can or other institutions can. And therefore, tech adoption simply becomes easier. So the size of the institution really is a determinant to the technology adoption in that regard.
And just to close off, I'll just make two more points about technology leaders that I always find surprising when I look at the data is in Central America, they're, needless to say, smaller markets, but Panama stands out and Costa Rica as well as two places that concentrate a greater amount of technology leaders in that region. And then on the other hand, we see in countries like Colombia, Chile, Brazil, that the technology leaders are also concentrated in some major cities. That's probably not surprising, but that just helps decision makers concentrate their export strategies on key major urban areas. And rather than having a countrywide coverage, if you focus your investments on some key major cities, that will likely get you the majority of the market share you're looking for.
Absolutely, absolutely. It's just as a reminder to everyone, here we are talking about equipment for the sake of this webinar presentation. In the full report, we also indicate some technology as the software technology, such as the PACS and the RIS that are present within institutions, where they rank in with their penetration level. So Carlos, that one's answering your question here. We are wrapping up the top of the hour. So I just want to thank everyone for participating. We'd be glad to stay on the line for a few more minutes to answer some of these excellent questions that have been coming through. But before doing that, Abel, if you could please move on to the next slides. I want to just share with everyone our contact information. Say that this report is available for purchase. It's $7,500. For participating today, you get 30% off if you're interested in buying the full report and all the detail. And on the next slide, you have our contact information, both Christophe and myself. So you can please reach out to us. Let's continue the conversation. Let's continue to the dialogue. For those that need to sign off, feel free to send us an email. We're quite responsive in that regard. We'd be happy to engage with you on a one-on-one note. Abel, thank you for sharing the link to the medical equipment and device report. So a few of the other questions that have come through, which are tremendous, and we're seeing them pour in. So this is very exciting. This is really the part that I love the most about my job, is to really engage with everyone in the audience. One great question that came in from an anonymous attendee is if financing, or the lack thereof, is still a favor that can slow down capital equipment acquisition across the region. And the answer is yes, absolutely, especially for the private institutions. What's fascinating here is that we see that a lot of the public hospitals, especially in a country like Mexico, for instance, the public hospitals tend to be much larger in size. Okay, the average public hospital in Mexico has approximately 100 beds compared to about 15 or 20 on the private side. And again, the size of the hospital is a key determinant to technology adoption, because it really impacts patient throughput and the number of cases that doctors are able to see. So when you're adopting technology, you really need to be able to see as many patients as possible to justify the existence thereof. And on the public side, we see that certain public hospitals are much larger than their private counterparts. Financing becomes a key element on the private institutions that don't necessarily have the patient throughput, but really need that technology to distinguish themselves from other players or from other institutions in the market. Okay. Chris, I'm not sure if there's any other questions that you want to tackle within the list that we're receiving.
I think that some of the other questions are very specific, and I think they're best addressed by emailing directly the participants, which is some of what I'm doing now. And some people have shared their contact information, so we can get back to them.
Terrific, perfect. I see another one here again from an anonymous attendee. If local and regional distributors will continue to be the best method to penetrate and sell equipment and devices in the region. For the short term, I would say that yes, that continues to be the predominant way to operate and get products into consumers' hands or into institutions' hands. That may change over time as large players, multinational players, get well established and start to own their distribution from start to finish. But again, we don't foresee them having the reach to be able to get to every single institution across the country. So again, countries like Brazil, 6,600 hospitals, Mexico, 3,300. A lot of these are small institutions which are hard to get to with a singular sales force, and therefore one needs to rely on regional distributors in order to get to every corner of the country to get to those institutions. So definitely a key element to keep our eyes on. Okay. Chris, any other elements that you would like to tackle here?
Yes, there was a question about distribution. Hold on just a second.
Sure. While you look that up, I'm going to tackle another one about surgical tables and components. So yes, absolutely, surgical tables and components are essential, especially in a moment like today where we're seeing a rebound of procedures. Again, we're not yet at the pre-COVID levels of procedures, so still relatively slow, but we do expect in some countries the procedure volumes to be a little higher than pre-COVID. The reason being that there's a procedure lag in many countries that need to be caught up. Now, we don't expect that lag to be caught up on a one-to-one basis. There's definitely going to be some degree of erosion and attrition within the procedures. The reason being that some folks are still very reluctant to enter the hospital space. Others have just decided to live with their malaise, and others simply don't have it anymore. Either they've passed on or found other treatments for it. So we do expect to see a certain degree of erosion and attrition of procedures, not a one-to-one recuperation. We do know that right now across the region, there's approximately 1.6 million procedures in lag, but not all of it will be coming back. We do expect these procedures to start coming back online over the course of the next 6 to 9 months, and may be pushed out further with the arrival of new variants of the COVID virus, specifically the Delta variation that we're seeing rise now.
I'll just take one last question. There was a question about insurance companies, how they react. That's quite a vast topic, but I did want to bring to the table one perspective, which I'll tie back to the inroads made by equipment manufacturers that are offering value-based and more economical models as hospitals are dealing with constrained budgets. So what we're seeing is that in some markets, such as Mexico, for instance, some surgeons who, in addition to be affiliated to one hospital, have a private practice, some are getting together and there is a creation of new privately held hospitals that are going in for a mid-market strategy. So they're going to be competing with the premium institutions by offering a certain portfolio of surgeries with a different set of more economical and value-based equipment, and charging a lesser price for those procedures. And part of their strategy is to appeal to insurance companies to cover a certain set of pre-established surgeries at a pre-established price. So that is something that we've been noticing in the market, and we'll be paying attention to see if it becomes a trend and whether it starts moving the needle in terms of market share.
Terrific, great point, Christophe. I'm going to take one last one as well that covers several points that have been brought up here. If we have any data on laboratory equipment or diagnostic facilities, and the answer is yes, this is something that we're currently working on now. We should be releasing some data, I believe, in Q3 or early Q4 of this year on these two types of facilities and institutions. And if we also monitor the aesthetics market, and the answer to that is yes, we saw a plummeting of procedures, obviously, during the COVID crisis, a drop of nearly 70 to 80% for elective and aesthetic procedures. We are seeing some of those recuperate and get back on track and online. We do have a specific monitoring of that. So Ted Fernandez, if you'd like to reach out, we'd be happy to engage with you in that discussion. With that, I want to thank everyone for participating today, for attending. Thank you for your time, and thank you for your lively and interesting questions. Definitely thought-provoking. Again, that's the part that I think both Christophe and I relish the most, is engaging with you. So please, let's continue the conversation. You have our contact information. We look forward to being in touch and to speaking to you soon. Thank you, everyone.